Hi, I'm Pam Tyler, and I will be reviewing the article Provider Interaction with the Electronic Health Record: The Effects on Patient-Centered Communication in Medical Encounters by Richard L. Street Jr. et al., which was published in the Patient Education and Counseling Journal. This article attempts to show how a provider's electronic health record workflow, such as gazing, keyboard activity, and silence, affects the quality of their communication with their patients. First, I will summarize the article. Next, I will give my review. And lastly, I will share some discussion questions that came to mind while reading the article. First, let me start by giving a brief summary. This article shows the results of a 2014 study conducted at the USA Veterans Administration Primary Care Clinic in San Diego. Participants in the study comprised of 23 primary care providers and 125 patients. Each clinic visit was videotaped in order to measure the amount of time a provider gazed at their computer screen. Also, each mouse click or scrolling performed by the provider during documentation was captured using special software that logs the usage of those activities. Another activity measured was the amount of silence calculated during a provider-patient conversation. This activity was coded by trained coders, showing the proportion of time during the visit when the provider and patient were not talking. Patients also completed a survey after their visit. The results showed that providers who spent more time gazing at the computer and whose visits had more episodes of silence were rated lower in patient engagement, concluding that providers were rated as having less effective communication when they spent more time looking at the computer and when there were more periods of silence during the consultation. The article also states that more research is needed to determine effective ways providers can communicate with the patients while simultaneously managing data in the electronic health record. Next, I'm going to give my review of the article. I was intrigued by how the study was able to capture the data by filming the consultations in order to track the number of gazes and counting the minutes of silence during each encounter, and tracking the amount of mouse clicks and mouse scrolls during the visits. The amount of gazing and multitasking used during a visit is something that I've seen happen during my clinic visits with my own provider. When their clinical practice initiated the use of an electronic health record system, there were instances where my provider would not say anything while trying to type and navigate through links and drop-down menus. With the increase of provider practices requiring the implementation of using the electronic health record, this will continue to be an issue. I felt this study and those like it are necessary in order to come up with solutions to improve communication between providers and their patients while using the electronic health record format. With that said, I was disappointed that the study was limited to only 23 providers, of which 74% were female, and the 125 patients of which 96% were male, and of those, 64.5% were Caucasian. I felt the sample size of both providers and patients were small, and the provider and patient participants lacked diversity in the way of race, gender, and economic background. Also, the study was limited to primary care clinics at the VA. I would like to have seen this study include specialist clinics, patients who have already had a communication barrier such as hearing impaired or those who speak a foreign language, and the inclusion of new patients. Lastly, there were 4 questions that came to mind during my reading of this article. What type of communication issues can occur when the provider spends long periods of time typing on a computer or staring at a computer screen? How can providers better communicate with patients when using the electronic health record to document a patient's visit? Discuss the types of communication issues you've experienced when visiting your provider whose practice utilizes the electronic health record. And what type of suggestions would you give to an electronic health record software developer that would help limit the disruption of patient-provider communication during an office visit? Well, this concludes my review, and I look forward to your feedback, thoughts, and questions during this discussion. Thank you.